Welcome, everyone. I wish I could see all of your faces and be in person, but here we are in this virtual format. We'll do a quick round of introductions for the Health UC Davis Steering Committee members that are here so you can know who we are. We're here to answer your questions. We're going to do a little brief background, go over the proposal process, a little bit about the budgeting, some tips, and hopefully get to your questions that you might have about applying for a Healthy UC Davis project grant. So we're really excited. We do these every 2 years, and yeah, we're ready to do it this year. So I'll start first. I'm Stacy Bresnan, the Director of Staff and Faculty Health and Wellbeing and the Healthy UC Davis lead. And I'll go ahead. Connie, why don't you start next?
Hi everybody, I'm Connie and I'm the Program Coordinator for Staff and Faculty Health and Wellbeing as well as for Healthy UC Davis. And I'll let Kiva go next.
Good afternoon everyone, my name is Kiva Clift. I work with Stacy and Connie in occupational health and help with employee wellness programming and oversee the smoke and tobacco free policy and the Work Strong program and communications for Health UC Davis. Sean, you want to go next?
Sure. My name is Sean Ismavugo, and I'm working as a graduate student researcher here with Health UC Davis. Brenda?
Hi, my name is Brenda Scalzi, and I am the Admin Director for Student Health and Counseling Services, and I am on the Healthy UC Davis Steering Committee.
I guess maybe I should go. I am Amber Ofeisch. I'm a senior budget analyst with HOA Business Partners. I work with Stacy Bresing as the budget analyst for her program, and I'm here to answer budget questions today.
Okay, I think that's everyone. Also serves as our DEI workgroup lead. So if you have any questions about what we're doing in the DEI department, we can direct them to Brenda. And she's with us for until 3:30. Is that right, Brenda?
That's right. Yeah.
So if it gets close to 3:30, you haven't asked any questions, and you have one for Brenda, go ahead and shoot it in the chat to her if you have one. Again, welcome. And I wish we could have introductions all around, but for the sake of time, we'll get started with the background. This first intro slide, you can see pre and post COVID times, but what's been really great post-COVID time is that we've actually been able to get a lot more people to our steering committee meetings because you don't have to actually be in a location, call them from wherever you are. So yeah, that's been really great, and we've been growing leaps and bounds with memberships and partners and stakeholders. So we're really excited about that. You can go ahead and go to the next slide, Sean. So just a little introduction about who we are. You'll see on the right sort of our conglomeration of partners and stakeholders, and these are all represented by people on our steering committee. But where we started was back in 2017, when Janet Napolitano, the UCOP president, decided to give each university a little bit of startup funds to get their healthy campus network going. So UCLA had a program that had been around since 2012, and they convinced UCOP to fund us to give us a startup fund. And we used that to build our kind of committee. And then we funded a few initial projects, and they had to be done super fast because they were done, I think we had a year to spend the money or something. So it was a really tight turnaround. So after that pilot year, though, what happened was we had a lot to show for what we were able to do with that small amount of money. And we were able to ask for some more funds, and leadership at UC Davis was very generous and gave us some funds to continue our work. And so that's what we've been working with ever since. And we had one more round of funding after that. So we had another group of proposals and projects that we funded. And this will be our third round. So each time, hopefully we are getting better and better at making a more efficient process. So you can let us know after this process how it goes this year. But we're really excited to get a lot of neat ideas in from the community. And again, Healthy UC Davis spans academic staff, students, campus, health, remote sites. It's really our entire UC Davis community. So we're really asking for proposals and ideas from everyone, and we'll consider proposals and ideas from everyone as well. You can go on to the next slide, Sean. Oh yeah, so after we received our funding, we sat down and we came up with our vision, mission, and goals. So just so you all know kind of where our minds are in Healthy UC Davis, the entire steering committee really hammered these out. So our vision is to make UC Davis the healthiest community in the nation. Our mission is to champion a thriving culture of health and well-being throughout the UC Davis community. And then we had these strategic goals, which may be good to keep in mind as you're coming up with your ideas for your proposals of different ways to sort of go about creating a culture of health and well-being. So our strategic goals included creating comprehensive, integrative, and collaborative leading practice initiatives and programs. And we wanted to provide UC Davis community members with any support they needed, opportunities, information, and tools to engage in healthy behaviors. And we wanted to advocate for policies, institutional practices, and a built environment that promotes health and well-being, so making the healthy choice the easy choice in many cases as much as we could. Continuously examining, implementing, and evaluating practices that improve the well-being of our community. So making sure that we're always evaluating any program or project that we do in a rigorous manner to make sure that it is actually making the impact that we intended. And then lastly, aligning our communication resources to ensure coordinated outreach efforts. So really trying to take all the great work that's going on across UC Davis and streamline it and make it easy to find for our campus community, for UC Davis community. Okay, next slide, yeah. So originally, our first few rounds of proposals, we really kind of siloed out these focus areas you'll see on the bottom. So we had nutrition and food, physical activity, mental and emotional health and well-being, and smoke and tobacco free. And so we accepted proposals in those categories. I think we actually had people choose each category that they were applying for. And this year, we're actually expanding that a little bit. We're actually not using those focus areas because a lot of projects could span 2 of these areas, 4 of these areas, or even have an area that we haven't considered yet. So we still kind of have these focus areas in our heads as important for health and well-being, but they're not the end all be all of what we're looking for. In fact, we came up with, on top you'll see our priority areas. So these are our priority areas that we came up with in our strategic planning process. That was a couple years ago we went through this, and the first 5 were communications, so making a one-stop shop for health and well-being for UC Davis. It was leadership support, so gaining and keeping and involving leadership in whatever we're doing and keeping their support. Metrics, coming up with a good way for us to measure our progress and programs to supply helpful metrics and processes for our partners and stakeholders. Physical space, so this came up as an issue. At the time, it was indoor space that was lacking in a lot of places. But also we wanted to improve the outdoor space and improve the built environment. And so a lot of, we've been working hard on this priority area, especially post-COVID. And then policy, creating health in all policies or healthful policies at UC Davis, and really striving towards that. And then lastly, just recently, we've added our diversity, equity, and inclusion work group, which we're really excited about, that Brenda is leading. So we've started to involve a lot more DEI work into our work, and are looking for more projects this proposal process that really focus on diversity, equity, and inclusion. So we're excited about that. So just a few examples of some previously funded programs and projects that we've done. And again, we had broken them up into our focus areas, so you can kind of see a little bit of that here. We funded mental and emotional well-being projects such as the manager supervisor mental health trainings. We funded an open access resource library and mindfulness opportunities on both Health and Davis campus. And a lot of these projects you'll see here too are actually continuing. They've either been taken over by an existing department or program, or Healthy UC Davis continues to fund them as needed. So we also funded food and nutrition projects such as looking for barriers to CalFresh access for students. We funded the pilot diabetes prevention program, which is now a thriving program under Staff and Faculty Health and Wellbeing led by Linda Adams. We funded a student project called the Food Access Map out of Student Health. Chantel helped lead that project. The food and beverage audit tool to look at different, to come up with a tool basically to measure how eateries are doing on campus and at the Med Center at promoting healthy foods and beverages. Healthy catering menus is an ongoing project. And the Nourish food labeling system has been really successful on both campuses as well to indicate what foods are healthy. And it was a project that actually involved all the dietitians from campus and the health system to come up with a great way to kind of put together what qualifies as a Nourish labeled food. And then physical campus space, our open space inventory project is looking at all the space we have on campus. And that's ongoing right now as well. Physical activity, we had some movement-based classes and projects. One that I'll call out just to talk a little bit about app-based projects, and I'll turn it to Kiva as well, but we had a Jewel Health app. So this is a third-party vendor that we hired to do some mental and emotional well-being with the School of Veterinary Medicine and Walker Tracker. So these two projects actually involved a third-party vendor that needed to go through a risk assessment with IET. And I'm bringing those up just because those actually were a little more involving than the original proposal thought they would be. So, or the proposer believed they would be. And so just if you are thinking about a digital app type of a project, you should kind of plan in about 8 months of going back and forth with IET on a risk assessment for those types of things. So just a little bit of warning on those. And let's see, we had a vape campaign. And then we also, before COVID, we're building a virtual remote attendance with Zoom webinars for all of our partners and stakeholders. So those are just some of the things we're working on. Once you apply, there could be some back and forth with the proposal committee. For example, the open space inventory project, that started off as a very different project, but in the back and forth with the steering committee, we asked for things like a needs assessment, and they had actually wanted to put picnic benches and tables in an area of campus that to enhance the physical space and to create a nice space, but they hadn't actually talked to the departments surrounding that space or talked to some of the facilities managers and things. So for example, we went back to that project proposal and asked them for letters of support and a needs assessment, which they provided. So just an example of kind of we're really looking for great ideas, and any idea that you have, we welcome. Of course, we'd like them to be well thought out, but if you don't have something right away, we can have a little bit of a back and forth between the proposal committee and the proposers. So we're open to that. And I will turn it over now to Sean and to Connie to go over the proposal process.
Perfect. Thanks, Stacy. Thanks so much. We have the link to our website here on the slides right here. And I'm also going to quickly put the link in the chat. And I'm going to do a new share screen real quick so we can walk through the web page. Just bear with me real quick. Is that viewable? Perfect. Okay, so on this web page we have, if you scroll through, we can see a quick intro as to what we're hoping for with the project grant. We also list our priority areas as well, which is something we hope that each application aligns with. And then as you go a little bit deeper, and we can find the button that takes you to the project proposal application process. And so this is done through the Qualtrics app, but right under that, we have a preview for the questions as a whole. So if you want to review beforehand and see these questions and kind of do a mock of what you want to write for that, that can help save time at the back end. So that's there for access if you would like to use it. And additionally, on the right here, we have a couple more features such as an About Us page that talks more about our missions and goals from Healthy UC Davis. We have a list of frequently asked questions that we've kind of collected over the years that can help guide some of your questions you might have regarding the application process. And then we also lastly have a flyer that can help with outreach if you want to share more about with some friends or other colleagues about application process. You can download that and share widely and be much appreciated. So that is our webpage, and it's a quick overview. And Connie, is there anything else you want to add before we go to our next slide?
Yeah, and I also wanted to add that we are recording this meeting, so thank you for those who are attending live, but we'll be adding a link to this presentation as well. So if you do know of any colleagues or peers or any individuals that you work with who you think this opportunity is, or who would enjoy this opportunity or be interested in applying, we'll add this link in the next few days to the recording.
Perfect, thanks, Connie. And then I guess we can go back to the presentation.
As we're going back, I also wanted to mention on that same page are 2-page summaries of all the projects that I mentioned before. So if you're interested in some of the outcomes and what we kind of look for, it might be good to peruse those as well. Because after the end of your project, we do ask for a 2-page summary of outcomes, a presentation, and we do ask for quarterly updates at our steering committee meetings.
That's right, thanks, Stacy. Okay, so I'm going to quickly go over some of the components of the application. Just kind of do a brief overview of what we're hoping to ask for. So just for starters, we have the contact information, so your name, email, campus affiliation, as well as if there are any co-applicants that help fill out the application. This helps a lot for just the back end where if we have any follow-up and want to reach out to anybody, we can make sure to include them in those emails. We also ask about what focus areas are being addressed in the application. So we had physical activity, nutrition, mental and emotional well-being, and smoke and tobacco free. And if you feel that your project does not fall under those, we have an other section as well, just to really make sure we can include as many projects as possible for this cycle. Additionally, we want to see which strategic priorities are being addressed in your application. So that can be found in on our webpage, on our website as well. And it's a checkbox situation, so it's not an open-ended question. So you can kind of see which ones you can click in that agree with your project as well. Next, we also talk about background and alignment. So we're asking more about how does your project align with the mission and goals of Healthy UC Davis, which again can be found on our webpage to help clear that up. And next up are specific aims and evidence to support. So for your project, it'd be helpful to include evidence of the need for the project you're hoping to promote. And there's also a word limit for this question. So it helps to, again, check out the preview to see what we're hoping to get out of that kind of question. So you can help prepare that and check with your colleagues before submitting your application. Next up, something that we're trying out for this 2021 cycle is the diversity, equity, and inclusion goals and objectives. And so on the application, it'll take you to a web page that shows those goals. And we want to see how your project's goals and objectives align with supporting diversity, equity, and inclusion. So that is something we're trying to focus on this cycle in particular. Next up, we have a question on budget as well. I'm not going to talk too much on that point because we have Amber here to really give some great examples and provide really great advice on that topic. So moving on to impact, we're also hoping to learn more about the long and short-term impact on who is it also impacting on campus. So whether it be students, faculty, or staff, hoping to get that out as well as sustainability. So with this project, once the initial project is complete, who's going to be leading this project after the cycle is over. So we wanted to get that information as well. It'd be really good to understand. And lastly, for evaluation plans, so what are the key outcomes for your project and how will those outcomes be measured? And so again, these are just the main questions you'll be asking the application, and feel free to click the link in the chat box to see the preview of the application so you can have that ready and prepared before you submit it. So other than that, we're gonna have Amber go through a few examples of the example budget, and even provides a couple of advice as well.
Okay, great, thank you. Why don't we go to the next slide? Before we really dive into an example budget, I guess first I'll mention that budgeting is an inexact science, and speaking as a budget analyst, a lot of times what we do is our best efforts to estimate what we think will happen. We try to think about things like uncommon costs, things that we give ourselves a little wiggle room in case we're underestimating some things. Because at the end of the day, a lot of times projects are really restricted to the funds that you're being given, and you want to stay within that budget. But you also don't want to get so overwhelmed in the budget building process that you just decide not to submit anything. So keep in mind, it's an inexact science. You do your best, and definitely give it some good thought, and I'm sure that you can come up with something really great. The first example is a physical project. And what I have here is, the types of things that I think might be involved in a physical project. This is not an exhaustive list, but you'll notice that there's some things that stand out, like I'm not just going to include the materials, but also the cost of getting the materials from point A to point B. So you have transportation fees and freight. When I'm putting the materials in here, I'm also going to want to factor in what's the tax I'm going to pay for the materials. I'm going to be thinking about, what if I don't use all of my materials and I have to dispose of some of them afterwards? You're also going to want to think about, do I need to pay for permits? Do I need to pay for a consultant to sign off on something? Do I need to pay for student labor? Do I need to pay for contract labor? Things like that. And we also always want to be thinking about, if you're trying to get the word out about your project or create any media around it and do communications, you should include a communications budget. And again, you might be sitting there thinking, well, gosh, what goes into that? You can Google, how much does it cost to pay for an image on Shutterstock? And, how much does it cost to get 5? You start asking new questions, and projects have a way of doing what's called scope creep, where the complications arise, the new questions arise, and and Brenda's heading out. So thank you so much for joining, Brenda. She graciously gave her email address, or how to contact her should you have questions for her. Did you want to mention anything before you leave, Brenda?
No, just if folks are struggling with how to incorporate diversity, equity, inclusion into their proposal, they can email the healthy at ucdavis.edu email address, and one of us will respond and work with them to incorporate that if they're struggling with that. So happy to help in that area if it's needed.
Great.
Thanks, Amber.
Thank you, Brenda. And then, so yeah, I didn't mean to go on a rabbit hole about scope creep. I have very personal feelings about that topic, clearly. But the story to hammer home with that is just giving yourself a little bit of cushion in your budget should you be a little unsure about what something might cost. Again, you have an example like communications. It's probably going to exist on most projects, is having some kind of communications budget. And also technology, if you have licenses or fees that are involved with that. Maybe it's a matter of, you want to do some of the designing yourself and you need to get a license for 1 year for something. That would be another example. And UC Davis has lots of great programs to select from that are already approved. And so it doesn't have to be something that goes through a vendor risk assessment if you're talking about technology. So let's go to the next tab and see if I forgot anything as far as helpful tips. This tab and the next one, or sorry, slide. It's called a slide. I'm an Excel person. Has some suggestions, things that you might easily forget to factor in. If a vendor says, oh yeah, that costs about $500, you want to say, does that include tax? Does that include freight? Does that include delivery fees? And then also building in, if you have a project that goes over 2 years, your labor costs next year are going to be a little bit higher than they were this year. And typically that's a 3% increase. And then additionally, students have 2.6% in addition to their hourly wage. That is just due to giving them liability insurance and paying a small amount of benefits for them. And then let's go to the next slide. We talked about wiggle room, always be a little bit on the cautious side. And we talked about quotes and digital projects. So I think we covered all the topics. Does anybody have a budget specific question that ties in with what we were just talking about, or something I didn't even talk about? Now would be a great time to ask. Okay.
I guess I do have a question.
Yeah.
If we're proposing a project that maybe we only need specific funding to do an aspect of it, is that something that you guys tend to support, or is it more like we would do a project that's entirely encompassed with whatever Healthy Aggies can give us? If that makes sense.
I think, Stacy, do you want to answer that question?
Yeah, we would definitely be open to helping a project out that has additional funding from some other place. In fact, I think on our application we have in kind, a spot where like you can write like what's in kind, maybe from your department, maybe your staff time is being given to the project, or yeah, your department is paying for some of the project. So definitely we would consider projects like that.
Okay, great, thank you.
Yeah, and I think, Stacy, one of the things we were talking about that didn't come up today is that if students are applying, there's also the option to make a student group. I think that was called CEI. Am I remembering that correctly?
CSI, I think.
CSI, okay, there you go. Yeah,
Yep,
so that's something that
student
people can look into as well. Clearly, I don't know a lot about it, but that's a great option as well.
Yeah, I believe we included a question in our frequently asked questions about that, or to help students out that wanted to apply. Because the student is not necessarily hired by a department right now that might want to apply for a grant or part of a student group, it's a little bit more difficult to give the grant money to that student. So we would encourage them to form a group, which I believe can be even just 3 people, and form maybe, and that it could actually be a good experience to put together, you know, 3 members of a group that could work on the project, because it will be difficult to work on a project all as a lone person in any case. So forming a student group is an option, or finding a department that would sponsor that student to do the project.
And it is an info session, so if anybody has questions, now's the time to ask. There's a question in the chat that says, once a project is funded, can awardees reapply in the next funding cycle?
Yeah, that's a potential as well. And some of the good things about some of the projects that have been funded in the past, if they show promise and have good metrics and show to be a really good program, those programs have survived. Like we've found a way to kind of keep them going, either rolling them under another program like staff and faculty health and well-being or student health and counseling services. A lot of times these projects just need to get off the ground, and then the running costs are, you know, minimal. So in those cases too, Healthy UC Davis might have some funding to continue a project after it's completed. But I guess these projects you can kind of consider pilot projects if they're entirely new, to sort of a proof of concept type of idea to see if it's merits continuing, basically. Does that make sense? And there's a question, is there a chance that projects can move on to be supported by UCOP? That's a good question. I would not say there could be a chance, but I think it's probably unlikely that projects would move on to be supported by UCOP unless it fits into the system-wide bigger picture, which Healthy Campus Network still meets monthly, and they have strategic goals themselves. They're actually voting on it, and we're having a meeting on Monday about kind of the direction that system-wide will be going. And so we can share that information too. So if the project falls under, I guess, the strategic goals that the Healthy Campus Network would like to work on this upcoming year, that could be a potential. Does anyone else have any other questions about these grants? It can be anything too. It can be, you know, if you have an idea and you want to like flush it out right now, we are here to help. And that's the thing too. I think our proposal committee really wants to see, keep calling them the proposers. I don't know if that's the right word, the applicants succeed. So we really want to see our applicants succeed. And you have a lot of backing with all the stakeholders and partners that also want to see the project succeed once they get up and going. So there is a lot of support out there for these projects. So don't feel like you're on your own. So your thumbs up, like Mercedes.
I'm always the person that asks a million questions at these things, but I'm on the other side now.
Yeah. I think you were just too good explaining all the budget stuff, Amber.
We just killed it.
Yes, I can ask another question. So I was looking over kind of the priority list areas, and for the second bullet, it was talking about metrics, and kind of the idea we're thinking of proposing is geared toward like a clinical health perspective. And so just in terms of metrics and like how to apply those beyond the student population, is there anything in particular? Is it more like survey metrics, or are they like clinical aspect metrics, or either?
Yeah, that's a good question. So yeah, metrics do not have to be, you know, in the nitty gritty clinical metrics. We have a lot of projects that do surveys, focus groups. We have projects that use participation data. So it doesn't have to be real, you know, you see a decrease in heart disease from this year to the next type of thing. Yeah.
I've also seen some really fun metrics around measuring your impact in terms of how many people you connected with. And as somebody who's very passionate about data and data visualization, you can do lots of fun visuals with like showing how you touch different aspects of the community.
Yeah, and Kiva does a lot of social media work for Healthy UC Davis. And so she's been able to put together some really great graphs on our reach and, you know, sets goals on how many followers on Instagram. You know, metrics can mean a lot of things. Yeah. Are there any questions on any of the?
Sorry, it's not a question, it's a comment. Just thinking about communication, you know, we have a extensive steering committee for Healthy UC Davis, and with representation from all over main campus and health campus and even some remote sites. So it really is a wealth of knowledge. And so if you do submit an idea and your project does get funded, there are, you know, different communities of people that that you have the opportunity to connect with. And the communication piece, yes, we encourage you to budget in that, but we do have a communication committee as well for Healthy UC Davis. So if you do need to get the word out, if you're trying to do a survey or recruit participants for a focus group or, you know, anything like that, we do have, you know, a modest Instagram following. We're shooting for 1,000 by the end of this quarter, but it's growing every day. and the student that we work with is really creative in how she gets the word out. So I know communication and social media, if you're not in the trenches with it, can be kind of overwhelming and hard to know where to start. But we do offer that as a support piece as well for projects for Health UC Davis.
Yeah, and Kiva stimulated me to think about another aspect that I thought I should mention too, is that Health UC Davis does not spend their funds on academic or staffing costs, but we can use our funds on student labor. So a lot of our projects actually involve a lot of students that get paid for their work, and some of them are MPH students that can actually complete their practicum projects as well. So yeah, we're really trying to keep the funds with the students and give them experience as well. So we have, I'd say that's where our primary labor force comes from, is from the students. And a lot of the projects at least have one student on it, working on it.
Seems like we're not getting so many questions anymore. So just wanted to reiterate that you are always welcome to contact us. Our email address is healthy@ucdavis.edu. You can also visit our website. You'll find a banner to the proposal grants page. So if you weren't able to copy that one down that was shared earlier, this is the easy link to get there. And of course, we're trying to reach 1,000 followers by the end of the quarter. So if you do have Instagram or have students you work with, staff members who might be interested in some of the content and resources that we talk about and post, please have them follow us at Healthy UC Davis. Oh, somebody just followed. Great.
Yeah.
That was me.
So I think we'll post this presentation on our Healthy UC Davis YouTube channel. So if you go to that, you'll be able to see some other presentations and things that we've done and our partners and stakeholders have done on that channel, which could interest you. Yeah, and if you are a successful project applicant proposer, we will also give you a lovely Healthy UC Davis shirt. So you can count that in, count on that.
I wasn't sure if I was going to offer this, but since there's not a huge number of you here, if you want to take down my name, which I don't mean that in a bad way. If you have a budget type question, feel free to reach out. If we had like 100 people here, I would never say that. So
thank you, Amber.
yeah, if you have a question, reach out.
Yeah, I can verify. Amber is one of the most helpful budget people I've ever worked with. So
Thank you.
take advantage. If that's it, if no one else has any other questions, going once, going twice, you know where to find us. And yeah, just want to reiterate, yeah, don't be afraid. Send all your crazy ideas, well thought out, of course, and put together for your proposals. We're really excited and we want to really keep pushing UC Davis to become the healthiest place to live, work, and learn. So yeah, we need your ideas and we're going to try and support them and really see if we can move the needle. So please apply and send on the word to anyone else you think that might be interested as well.